Maya Durbin, and I want to talk about cancer. So, I have a question for you all. Do you guys believe that cancer is a choice? Does anyone think that cancer is a choice? No. Okay. So, within this past year and a half, I've had 3 of my family members become diagnosed with cancer, and one of them passed away. So this had me thinking, is cancer genetic? Potentially. We know that breast cancer is a common known cancer that can be passed on through generations, and also prostate cancer can be passed on through generations. So is cancer genetic? Potentially. But then we have the cancers that aren't usually talked about, like oral cancer. Is that genetic? Can we choose to have oral cancer? Potentially. Well, cancer is something awful, and sometimes we don't choose. But in other cases, we can. For instance, there are cases where studies have been done in the by the World Health Organization in 2005, where 90% of the people who had oral cancer, 90% used tobacco products. So this means that potentially cancer can be a choice. So what is cancer? Cancer is a cluster of cells that no longer can perform the function that they were set to perform. And this cluster of cells, they could cause a tumor, and this tumor can override your system, and you may have to have it removed surgically, or you may have to have it shrunken by chemotherapy or radiation. So when you think about cancer, and oral cancer specifically, you have tumors growing in your mouth. That's on your tongue, around your gums, in the back of your throat, anywhere in your mouth, that's considered oral cancer. So who would choose to have oral cancer? Well, in a journal based on Indian studies in 2008, there was a guy named Richard M., and he conducted a study and found that in most cases, tobacco use is the leading cause associated with cancer, oral cancer specifically. Also, in 1994, there were 25 patients that were tested on in a control group, and these patients, they had treatments, and years after their treatment, they had dryness of the mouth. So 3.5 years later, they're still not capable of producing enough saliva. And also, 40% of these patients, they could not regain their weight. So this was due to the fact that they couldn't eat. So oral cancer prevents you from being able to swallow. And who would choose to have oral cancer? So basically my question is cancer a choice?